I bet you haven't heard of my top 5 strangest plastic surgeries. The top 2 are doozies. Do you feel like the soles and the heels of your feet have gotten thinner? They may have gotten so thin that you find it hard to walk long distances or wear certain types of shoes. Well, the soles and the heels of your feet have fat pads that basically act as shock absorbers. And these fat pads can get thinner with time, and it can make it difficult to walk long distances. Now, this can be worse for some people due to their genetics, and some doctors believe that how you treat your feet can have an impact on these foot pads. If you, let's say, walk barefoot on a concrete for long periods of time, that may cause damage to these foot pads and make them get thinner with time. So doctors now are treating this by injecting filler into the feet. Now, these are the same types of fillers that we use to cosmetically enhance, let's say, the lips or the cheeks. You can take those same fillers, like Restylane and Juvederm, and inject them into the soles and the heels of your feet. Now, these fillers typically last anywhere from 6 to 12 months. Some doctors are even injecting Radiesse and Sculptra to get a longer lasting result. And if you want the longest lasting result, then there's some plastic surgeons who are injecting your own fat into the feet. So instead of taking that fat and putting it into your booty, you put it into the soles and the heels of your feet instead. In Japan, where palm reading is a very popular way to determine your future, people are taking their fortunes into their own hands or their own palms. So if you change the lines on your palm, that will change your palm reading, which could potentially change your fortune and your future, or so they believe. So Japanese plastic surgeons are actually performing palm line plastic surgery to add wrinkles into the hands to change people's fortunes. Now, they claim that you can't just use a simple scalpel and cut lines into a hand. That's not going to work. You have to use electrocautery. You have to actually burn these lines into the hands to change their actual reading. And it kind of reminds me of that show Yellowstone, where people are getting actually branded in today's day and age. So the doctors start the procedure by having you actually take a marker and draw the lines on your palms that you want. Then they go ahead and burn those lines into your hands. So what types of lines are men and women asking for? Well, in men, the most popular changes to the lines are to the fortune lines. Essentially, they're changing their palm reading to make it so that they make more money in the future and they're more successful. But is that the same for women? Well, not surprisingly, it is not. The most common line for women to change in their palm is the marriage line. Now, this is in Japan, where the culture is quite different than here in the United States. I'd love to hear what you think. Do you think here in the United States or Canada, most men would change their reading to make more money and women to change their relationship status? Or maybe vice versa? You can actually get several inches taller with surgery, and you can do this at virtually any age. There are orthopedic surgeons throughout the United States and throughout the world that are performing leg lengthening surgeries, and these operations do work, but they are a bit scary. Let me explain. The operation starts by the surgeon literally sawing your femur or your tibia in half. Then they apply a device to the ends of the bone. Now, this can either be a device on the outside of the leg called an external fixator, or a device that's on the inside called an internal fixator. These devices work by slowly separating the ends of that bone. And typically the patient or a family member turns a screw which separates the bone by literally 1 millimeter per day. So if that separation is limited to that 1 millimeter a day, new bone will actually grow into that gap, and it's called osteogenesis. Most people gain approximately 1 inch per month, and they get treated for several months. After you have the height that you're looking for, you have to leave that fixator in place for several months longer for that bone to consolidate, or to basically harden and heal into place. Now, as you can imagine, there are a lot of risks with this operation. And the risks start with infection. You can get an osteomyelitis. That can necessitate IV antibiotics and other types of operations to treat the infection itself. There's a risk of bleeding. There's a risk of non-union, where the bone does not heal into place. And everybody has a ton of pain with this operation. But the absolute worst thing that can happen if you have this leg lengthening surgery, and honestly, any operation that you have, is that you can die. There was a case report published in 2018 of a woman who underwent leg lengthening surgery, had a fat embolism, and died from it. And this is essentially when you break the bones, some fat can actually escape and go into the bloodstream. If that goes to your lungs, you can die. So as you can probably tell, I'm not a big fan of leg lengthening surgery. It's pretty scary. It may be indicated in certain patients, but I really wouldn't do it willy-nilly. So what can you do other than surgery to get taller? Well, once you have reached a certain age as an adult, there isn't a whole lot you can do. But if you are younger, you're going through puberty and you're still growing, definitely you want to get a lot of sleep. While you sleep, your body secretes growth hormone, and that can help make you taller. So the more healthy sleep you get, in general, the better for getting taller. Some other general things that you can do that can help you get taller as you're developing is to eat a healthy diet, to exercise regularly, and definitely to refrain from smoking. Are you like the millions of people who have a bathroom filled with half-empty bottles and tubes of skincare? They may have promised to reduce your wrinkles, lighten your blemishes, and help you feel better about your skin, but none of them actually worked. Well, I've got the answer for you. It's called Youn Beauty. Youn Beauty is one of the only skincare lines that combines natural and organic ingredients with the latest and scientifically proven components like vitamin C and retinol. I'm so certain that you'll love Youn Beauty products that we offer a 30-day money-back guarantee, no questions asked. Head to younbeauty.com and use the coupon code 20OFF to get $20 off your first order over $99. I'll put a link in the caption below. Once you try Youn Beauty products, I bet you'll throw away your other skincare products and start loving your skin again. Thank you for putting your trust in me. During this procedure, a doctor starts by locating the Grafenberg spot, otherwise known as the G-spot. And this is an area typically on the anterior or the front surface of the vagina that is known for causing pleasure for a woman. The doctor then injects a local anesthetic into the G-spot and follows that up by injection of a hyaluronic acid filler, like Restylane or Juvederm. The idea is that by injecting this filler into the G-spot, it makes the G-spot larger, and that can help enhance a woman's sexual experience. So is there any truth to this? Does the G-shot actually work? Well, there was a pilot study that revealed that 87% of the women who underwent the G-shot had an improved sexual experience. But what is a pilot study? Well, therein, my friends, lies the rub. A pilot study is typically a small study that is not published in a peer-reviewed scientific journal, so it doesn't necessarily have a whole lot of power behind it. And as you can probably imagine, this study was funded most likely by somebody who is making money off of the actual procedure. So should you or your partner try the G-shot? Well, there's no definitive proof that it actually works, so I would say buyer beware. So what is the number one strangest plastic surgery that nobody really talks about? We've all gone to a shoe store, found a shoe that we've really liked, put it on our feet, and found that it just doesn't quite fit well, or it's just not comfortable. So in that situation, what should you do? Well, most people would put the shoe away and find a different shoe that they like. But that's not the case with everybody. Instead of finding a different shoe that will fit your foot, some people are changing the shape of their feet to fit their actual shoe. Now, this is called Cinderella surgery, and it typically entails a number of different procedures, some of them a bit more extreme than others. It's not uncommon for people as they get older to develop bunions on their feet, and this is most common in people who wear shoes that have real high heels or really contoured and narrow. Bunion removal surgery is performed all the time by podiatrists across the country, but it can be quite painful. So this is the first part of Cinderella surgery that is pretty common and is not at all controversial. The second type of operation is a little more out there. 15% of the population has Morton's toe, and this is that condition where the second toe is longer than the big toe. Now, most people live with it, not a big deal, but there are some people that find that it can make fitting into shoes very difficult, and they can undergo an operation where that toe is shortened. In order to perform this procedure, a podiatrist then takes that toe and shortens a bone by cutting a segment out of it and then pinning the segments together or screwing them together. You can find photos like I'm showing here of people who've had this procedure done, and it looks pretty good. So what is the final part of Cinderella surgery that is definitely out there? There is a term called toe-besity, and this is a strange term utilized to describe toes that are, I guess, too fat. And so some doctors have taken it upon themselves to advertise liposuctioning of toes. So you combine liposuctioning of toes with shortening of a Morton's toe with bunion removal, and now you've got Cinderella surgery. Now the G-shot is not the only cosmetic treatment that women are having down under. It's been reported that celebrities like Kim and Kourtney Kardashian and Jada Pinkett Smith have undergone vaginal rejuvenation. So what is that? Well, I cover all about vaginal rejuvenation and the celebrities in this video right up here. These controversial treatments are super popular today, but have come with an FDA warning. Check it out in this video. And remember, eat real food, use clean skincare, and only consider actual plastic surgery as a last resort.